Hi, everyone. Welcome to the October 2023 version of Ask the Expert interview series. Today, I'm excited to have Dr. Karen Krigger with me today from the University of Louisville. Dr. Krigger has been instrumental in helping us to get connected with some of our vision screenings that we now do annually. So I'm excited to talk with her. But I'm first going to let you introduce yourself and tell us a little bit more about what you do as the Director of Health Equity at the University of Louisville.
Good afternoon. Glad to be able to speak to your group today. I'm a professor in the Department of Family and Geriatric Medicine, where I see patients, but I also have an administrative role in the Office of Diversity and Inclusion at the Health Sciences Center. I work on projects and presentations that provide education to both lay and professional organizations on chronic diseases and their effects on marginalized populations. I work with students and the different schools in the Health Sciences Center and main campus to provide surveillance, identification, and education of chronic diseases in disparate parts of our county. And lastly, I produce a film series in February with the Louisville Free Public Library and the Mayor's Office, highlighting films of social justice, medicine, LGBTQ+, and culture through the lens of the Black experience in America. The films are followed by a panel of academics and community leaders with community opportunity to ask questions and offer their opinions about the discussions at hand.
Awesome. So you have a wide breadth of knowledge. You work directly with patients, with students. You mentioned to me that you were previously a science teacher at Jefferson County Public Schools. So you've taught many different levels and, work with many patients of different backgrounds. So that's why we're so excited to have you on today to talk with us about October being Health Literacy Month. So this is something that was started by the U.S. Department of Health and Human Services back in the 70s. They started a report by the Surgeon General, and we're now at the, several years later, Healthy People 2030 report. And a big part of that report that they're working on and studying for is to address health literacy, both personally based on how patients feel that they are health literate, and organizationally on how us organizations, whether it's the University of Louisville or Kentucky Lions Eye Foundation, are out advocating and educating for health. So we just want to touch points with you on both of those. With personal health literacy, kind of being how individual patients, I guess it's defined as if individuals have the ability to find, understand, and use information and services to inform them about health-related decisions and how to act for themselves or others. So first, let's talk about that. And so as your experience with patients, how do you feel the majority of your patients or even students, how would they rate themselves as being health literate? Do you feel like the majority of people here in the Louisville, Southern Indiana area feel that they are 100% on top of it? Or do you think there's, still a lot of learning to do?
Well, you have to understand that when a patient comes into the medical office, they only hear 1 out of every 3 words we say because of the stress of being in the office. And oftentimes they're by themselves, so they don't have someone with them who later can reflect on what they've seen. Within our electronic medical records, we have the capability of printing out, not as extensive as the videos, but we can print out patient information to give patients about the medications they take and the conditions that they have. And I take every opportunity to give what I call homework to my patients about what their conditions are. Knowledge is power, and that includes knowledge about your own health And I teach medical students how to access that feature within our electronic medical records. When I was a student at JCPS, we had health education classes. And while I didn't appreciate them at the time, I have since learned that the foundational information that we received helps people to understand what the relationships are between their lifestyles, the food choices, the availability of foods, their education, and the disease outcomes that they may have with diabetes, hypertension, hyperlipidemia, and all these other things that affect us. Additionally, sports in the school system is not what it was when I was a student, and access to organized sports in the community and within the school system are sort of dependent on a lot of factors. We need physical activity to keep us healthy at all ages, preschool all the way up to geriatrics. But if you are a student whose parents are working, you may not have transportation to get to the practices or to the games. You may not be able to afford the fees or the uniforms to participate. And don't forget the physical education exams that you have to participate in sports. So we're not supporting our younger generations, and we're not making things available to our seniors to continue education about physical activity as well. I also want to speak about the constructs of a medical visit. If you've been to the office in the last 5-10 years, you realize your visit is 15 to 20 minutes. In that time, the practitioner is trying to assess what your needs are, reviewing your medications, reviewing your history, making decisions about what treatment plans, but there's not a lot of time for education. I think that patients, all patients, despite what their level of education or what their previous interest in their health may be, when they find out that there's something wrong with them, they want to know what it is they can do to make it better. And we simply are not structuring our medical visits to account for that. Then we have what I call the digital divide. We have sections within our state and within our county where less than 40% of the individuals there have access to internet, or they don't know how to use the hardware or computer software. So they can't access health literacy information on the World Wide Web that's provided by their medical provider. So those are problems that I see currently that I hope 2030 will be able to put a better lens on and come up with better solutions than we have now.
And so what are some of the common issues that you hear from patients that cause them to feel either stressed or just unsure about their health care?
Insurance is a big one. There are patients that are glad to be working, and for the first time, they may not be on government subsidized insurance, and they're very happy about being able to choose a health plan, but they may choose, because of cost, what I call catastrophic medications and healthcare planning. It allows them to have one physical a year and one acute visit, which is inadequate to cover them if they have hypertension, diabetes, obesity, or hyperlipidemia. And they quickly find out that they don't have the health care that they used to have. Then we've got, right now, we're in the Medicare enrollment period, which goes through December 7th. And people have lots of choices on what plans to choose. But with those choices, the insurance plans have formularies, and they don't understand that a medicine that they were on or a provider that they used to see, they can no longer engage with because their insurances aren't supporting them. But I'm just going to say we need to have one plan. We need to do that to make it easier for patients to access the care and the medications that they need. They have issues with pharmacies, access to the hours of the pharmacies, trying to reach them by phone because they can't access the digital platforms that have been set up to eliminate the one-on-one communication in the healthcare system. And so, yes, we have issues from them getting their medications, getting their access to their providers, and what's covered in their insurances.
Was there anything that just over your career, have you seen any improvements in anything? Have things gotten better in any way as far as, reports from patients on feeling better about their health literacy?
I think so. One is when we first got our managed Medicaid system, the information sent from the state was in English. And I called and I said, there are a lot of other languages that need to be addressed, and that has been. So we have a sense of awareness that we need to be able to communicate with people in their primary languages. And in some cases, because of disabilities of hearing and sight, need to be accommodated. And we have tech that helps us with that. I think we are increasing our access points to where people live for both primary care, urgent care, and with the new hospital being built in the West End. That's a positive. Mail order pharmacies have made it so that people don't have to wait in line at the pharmacy. They're incentivized with their costs to utilize these for their insurance companies, and I think that can be a positive in a lot of cases. We have recognition now of health disparities where we're not pointing fingers at the patient, but we're understanding that their health is influenced by policies, infrastructure, institutions, and racism. And coming to grasp with those helps us to better understand how to take care of people efficiently and optimally. COVID, if you want to look at the silver lining to COVID, we were admitting people to hospital with COVID, giving them the same treatments, but patients in marginalized communities were dying at higher rates. And we began to look at where these patients were coming from and what access they had to healthcare and medications, and linking the outcome to COVID to what the patients were bringing to our hospital doors. I think we have done a better job in my time, and I'm actually reading books about health disparities and their foundations for the last 100 to 200 years. And yes, we have come a long way.
Any issues or problems that you have seen decline or get worse during your time? And some of these may, with COVID being so recent, I feel like things probably plummeted and took a dive for the worse for a while. But, just anything overall that you have seen maybe decline.
Yeah. It used to be that you had one provider through your lifetime, and I'm very privileged that I have patients that I've been caring for 30 plus, almost 40 years. But when people change insurances and they have to change providers, that information doesn't transfer always. And so I think that's something that our systems have made it more difficult for people to have comprehensive health care, forcing patients to leave offices. And I'd be honest with you, a lot of times they return, but it's dependent on the insurance company, which is dependent a lot of times on their employment and the systems that are set up by the state. Something else that has affected healthcare, I think, is the amount of time physicians and providers have to spend outside of the exam room. So for every half day you see patients, you're spending 1 to 2 hours after the clinic is closed doing things that used to be performed by individuals, but are now on an electronic platform, so that the providers are required to do that. And I think that's problematic. I have seen with the COVID, the lack of confidence that people have in vaccinations. When I was 5 or 6, before you were born, several times, when the polio vaccine came, you went to the local school or health department, you were in line, and you received your polio vaccination. Other vaccines came along the line, but now that we've had COVID, people have been mistrusting. And in the states that we have seen our providers, politicians, our infrastructure not support the vaccines, we've seen higher deaths of COVID. And I think that's unfortunate that we have lost credibility in science and the ability to keep people healthy. One of the distressing things that I have personal problems with are the commercials that are on television with all the drugs. One, a lot of these drugs aren't available to people on certain insurance plans. And two, the litany of side effects is enough to scare anyone. And so, yes, I think that's something that has become worse, our commercialization of healthcare. Yes, I'll stop here.
All right. And so kind of moving on to organizational health literacy now, and how organizations communicate to the public regarding health. Has this changed over your time as a physician? I mean, when you started, were organizations promoting health the same way, or what changes have you seen?
I want to talk about positive changes in that they recognize that their patients need education about their health. And some insurance companies have sponsored workshops where patients with certain illnesses are invited to come to learn about their illness. Some insurance companies have gone into marginalized communities and neighborhoods and supported workshops to teach people about their illnesses. Some have provided electronic platforms to learn. I think there is still a niche for telephone platforms, but here's the problem. Because we have so much spam, people don't pick up their phones unless they have identified that it's coming from their provider office. And so we need to come up with a system where people can actually call in and maybe hear a 5 or 10 minute explanation of what they can do to fix their high blood pressure or control it better, or their diabetes, or be able to call into an insurance company and say, I just want to listen. I don't have the computer hardware or software to do this on a video conferencing like we are doing now, but I would like to know more information and have it available to me. Some insurance companies are providing financial incentives. So if you get your flu shot, you get a $5 gift card in some way. Or if you get your mammogram on time or your colon cancer screening, you are financially reimbursed for that. And some insurance companies are providing resources and support for smoking cessation, which I think is great because that's one of the reasons that we have so much chronic illness in our country and state. I am pleased that politically in our community, there is recognition of the maternal health death and mortality, which in some parts of our county and country rival third world countries for the death of mothers within 30 days after giving birth. So there are movements to increase access to maternal health care in the forms of midwives, doulas, and birthing centers. And I'm very pleased to be alive to see that happening. And yeah, go Louisville.
So as the director of health equity at U of L, how do you work with your team to ensure that information is spread equitably? And then just kind of explain how that's determined or measured.
Well, that part of my life is through Compassion Clinic. It's a student-driven initiative. And we go to areas that have been identified with the Metro Louisville Department of Health and Equity report. We're working on the 2017 and 2021 editions. So where there is health inequity of chronic disease, that's where Compassion Clinic is targeted to go, to provide services of surveillance, identification, and education in those areas. And we provide it optimally in more than just English languages. So if we know that we're going to be seeing a Spanish population, we provide our educational materials in Spanish. And if we know that there is another community that's inviting us in, we try to make arrangements so that we have interpreters or translators available to us. I believe that one day, hopefully, our medical systems will make available to their patrons, their patients, places where they can go and learn how to navigate their electronic medical records to communicate with their physicians, make their appointments, and check their labs and the office visits. So they don't have to spend their minutes waiting online for a person to ask, but when they do need a person, that's available to them. I hope that one day that we will have connections in neighborhoods where patients know there's a schedule where they can go and have their blood pressure, their sugars, their asthma assessed, and that information transported digitally to their primary care medical home. But they don't have to travel or worry about transportation. They know that at this time it's going to be in their neighborhood that they can access these services. I think knowledge is power, and I want to empower the patients that are watching this to ask questions of their providers. And if the provider doesn't have time or doesn't have the answer, if they can point them in the direction where they can get more information. And if we have institutions that are watching this, I hope that they will make advancements in understanding that all patients want to know about their disease process. They want more information, and they need our assistance to bridge that information. Thank you for the invitation, for allowing me to share my ideas with you.
Thank you so much. Again, this has been the October 2023 Ask the Expert interview with Dr. Karen Krigger. Thank you so much for being on with us today, and we hope everyone has a good evening.
Take care, everyone. Be healthy.